Today I'm going to demonstrate to you how to manage a skin tear. Unfortunately, Greg has sustained a skin tear. Firstly, we're going to try and realign. We've rinsed the wound well, and using the skin tear pack, we've moistened our cotton tips. We're rolling that skin tear flap back into place and squeezing out any of the collected congealed blood underneath and making sure that we can get that skin flap in connecting to the wound bed to be able to reperfuse. We can then measure the wound, and the measurers come in the pack, and so we measure the wound, and then we'll be able to look at this and understand whether we need a larger dressing than what has been made available to us in the pack. This can easily be removed. This is the size dressing that it comes with, but today I'm going to use a Leave and Gentle, the light, because this is aligned. There's not a lot of exudate there. Greg's not on any anticoagulants, so I feel fairly confident that this is going to take up the amount of exudate and fit the wound size. Before I place the dressing onto the wound, I'm going to put some Secura skin barrier protective film around the wound, and then I'm going to place the wound dressing on. Greg, this shouldn't tear your skin on removal because it is a silicone. We've fixated the flap into place and that's positioned beautifully. Most importantly, I need to indicate which way to take this dressing off, and we want it to be removed downwards this way. So I even write, in case we get confused, I'll even write remove this end first. And after you've secured your dressing into place, I like to pitch a frame going half on the dressing and half on the skin and wiping that around. And so that secures the dressing nicely. And so in doing that, we're unlikely to get any movement or lifting, and being able to keep that on for as long as we can. We may look at that again in about 4 days and in a new skin tear, and just checking that there's no sign of infection. To also protect the area, I'm just going to put some Cool Fast on and be able to protect Greg's limb there. This doesn't have any compression in it, so I'm quite happy to just fold that back, or you can cut it off. How does that feel, Greg?
That's good.
All right, now you be a bit more careful, won't you? Thank you for that. And that is the best practice in the management of skin tears.